Revolutionary Steps in Surgery. Chapter 4.2, Unit 4, English balbharti, Standard 8th. Surgery dates back to as early as 600 BC. Shushruta Samahita is one of the oldest works in the world dealing with surgery. It indicates that Shushruta was probably the first surgeon to perform surgical operations, plastic surgery. Later, some ancient surgeons performed tooth extraction and bloodletting. Major surgeries could not develop for centuries because of lack of knowledge and technology. The doctors had to cut open the part of the body that was not healthy, remove it, or set right that part. This would involve a lot of pain to the patient. Generally, anesthetics like ether or chloroform developed only from mid 19th century, making painless surgical operation possible and successful. Modern techniques are used nowadays for anesthesia. Generally, anesthesia benumbs the whole body and it is used for surgery of any region of the body. For local anesthesia, local anesthetics are injected into surgical spot or an area near nerves. Over the years now, revolutionary steps have been taken in different types of complicated surgery, and these have made such surgical operations successful. Let us start with cardiac surgery. Today, if you need to have a heart surgery, you can choose from many fine doctors. However, before 1893, this type of surgery was unknown. Doctors did not have modern medical tools and procedures essential for heart surgery. In those days, heart patients were treated with sedatives and they usually did not survive. Then in 1893, Daniel Hale Williams, a young African American surgeon, attempted a new medical technique in order to save a patient's life. A patient, James Cornish, was suffering from a serious knife wound. The knife had cut an artery less than an inch from his heart and punctured the pericardium, the sac around the heart. Dr. William, with six staff doctors, performed a complicated and daring operation. Dr. William became the first surgeon to save his patient by successfully repairing the human heart. Now, many more advanced techniques are used to in this specialty to deal with heart complications. Open heart surgery, which can help to repair heart defects, heart valves, or even replace them, is also performed successfully with proper measures. Patients can recover from cardiac surgery faster than they did before. Neurosurgery is another recent specialty to have received recognition. Since the early 90s, it is concerned with the treatment of disorders of the nerve system. Neurosurgeons operate on brains, the spine, or nerves. They can treat patients of all ages, from the newborn to the elderly who have suffered a stroke. Harvey Cushing, 1869 to 1939, is considered to be the father of modern neurology surgery. In the early part of the 20th century, he developed basic techniques and instruments for operating on the brain as a distinct surgical specialty. Crushing dramatically reduces the mortality rate for neurosurgery from 90% to less than 10%. By the time of his retirement in 1937, he had to successfully removed more than 2,000 tumors. The main reason that mortality rates had been so high before was blood loss. Among Cushing's significant achievements are the methods he developed to stem his blood by inventing a clip called silver clip or Cushing clip. This neurosurgery is one of the most cutting edges in the world of surgery and medicine. What is a robotic surgery? The robotic surgery is a type of minimal invasion surgery. Minimal invasion means that instead of operating on patient through large incisions, use is made of miniaturized surgical instruments that fit through a series of quarter-inch incisions. When performing surgery with Da Vinci, the world's most advanced surgical robot, these miniaturized instruments are mounted on three separate robotic arms, allowing the surgeon maximum range of motion and precision. The Da Vinci's fourth arm contains a magnified high definition 3D camera that guides the surgeon during the procedure. The surgeon controls these instruments and the camera from a console located in the operating room. Placing his fingers into the master controllers, he is able to operate all the four arms of Da Vinci by looking through a stereoscope high definition monitor. The robot literally places the surgeon inside the patient. This gives him a better, more detailed 3D view of the operating site than the surgeon's eye can provide. Every movement he makes with the master control is replicated accurately by the robot. When necessary, the surgeon can even change the scale of the robot's movement. If he selects a 3 to 1 scale, the tip of the robot's arm will just move 1 inch for every 3 inches that surgeon's hand moves. Utilizing this advanced technology, surgeons are able to perform a growing numbers of complex surgical procedures. Since these procedures can now be performed through very small incisions, our patients experience a number of benefits compared to open surgery of the past. Thank you.